previously in one of my videos, I have talked to you about setting health goals, and one of the things I spoke about was routine medical checks. So what is a routine medical checkup? These are medical checkups that you take when you are totally healthy, you feel healthy, you have no pain, and you have no complaints. But it is a habit, a culture that you need to build, because routine medical checks are very critical for you to actually remain healthy. One, they help you to prevent disease. So when you check in, you're able to get, health advice regarding certain conditions, and so you can prevent disease. Number two, routine health checks help us to catch the disease early on time. So when we make an early diagnosis, of course, treatment is also instituted early. And when treatment is instituted early, the chances of cure and low costs of treatment are also very high. The third reason is that routine medical checks, apart from helping you prevent disease and early diagnosis, they also help you to prevent complications. So when a disease condition is diagnosed late, chances are that you're going to develop complications, and then you need, of course, longer treatment periods and dealing with the complications of the disease. So where can you have a routine medical check? I would say that at any health facility close to you, a trusted healthcare worker, a certified healthcare worker should be able to do for you a routine medical checkup, because they are very simple, like we are going to see, and they help you to keep your health in check. So once you check in with your healthcare provider at a regular health facility near your home, they should be able to give you these tests. Now, some of you are asking, Happy Doctor, when can I take these tests? These tests are taken based on risk, but also based on age. So I will speak to you about the different age categories where you should take a routine medical tests. Now, the other thing you need to know is that there is no designated, schedule, yes, that has been put out there for you to take routine medical checks. But I'm going to give you suggestions of when to take which tests. So we begin with the younger ages of about 18 to 29 years. Basically, this age, your body is expected to be very healthy. You're going round about your business. And so a physical health check is important. So physical health check is basically, they look at your physical body, how your skeleton is doing, how your skin is, and give you a report on how you are. And then lifestyle counseling. We know that this age is full of a lot of activity. Young people are happening here and there. So you need lifestyle counseling about harmful habits like smoking, like alcohol consumption, and then your sexual reproductive health. So when you check in, you should be able to ask for this information regarding your lifestyle. And then the other thing about this age group is for you making sure that you're up to date with your immunization schedule. Depending on the country where you live, the immunization schedule may vary. But if you live in Uganda, some of the vaccines that an adult should have up to date are, of course, the COVID vaccine, the yellow fever vaccine, the tetanus vaccine, hepatitis B, yes, vaccine, and of course for the ladies, the human papilloma virus vaccine, HPV, for those that are eligible. So for you to know which vaccines you're actually eligible to take or that you qualify to take, you need to check in with your healthcare provider. Now we look at those in the age category of 30 to 39 years. This is an age group that have become extremely active. There are a lot of changes around people in this age category, family responsibilities increase, career responsibilities increase, and the career curve is going high. So you expect that the stress levels are really high, the coping mechanisms have to be top notch for people in this age category. And so this also puts this category of people at what we call metabolic risk, high metabolic risk diseases. Okay? So what are some of the things, that the parameters that someone in this age category needs to check out for? One, you need to regularly check your weight. Of course, your height won't change, but your weight and height will give you your body mass index. And your healthcare provider will interpret it for you based on your age, if it's high or low. And when it is high, of course, the risk for developing what we call metabolic associated diseases like hypertension, high blood sugar is high. And so you'll need what we call lifestyle counseling based on the classification of your body mass index, or what we call the BMI. Yes. And then checking your blood pressure regularly. You need to take these check-ins, these metabolic risk check-ins, at least every 1 to 2 years. But the more frequent, the better for you, especially if you identify that you have a risk. So when we take your blood pressure, we simply want to diagnose, to understand, are you in what we call a pre-hypertensive stage? On your way to developing high blood pressure, is your blood pressure normal, or you have actually already developed high blood pressure? Sometimes it's actually low blood pressure, but commonly high blood pressure. And definitely if you have it, like I told you in the previous video, that you will need to start treatment earlier on. Now the other test you need to take is for your blood sugar. Your blood sugar. So they take your blood sugar and then what we call HbA1c. HbA1c will help us to find out, do you actually have a risk of developing high blood sugar, what we call diabetes. And depending on what the findings are, then you're able to get health counseling appropriately or start treatment appropriately. So you need to make sure that you check in for those. And then of course, lastly, for this age category is what we call the lipid profile. Simply put, lipid profile, we are checking to see your fat level. Fat level. Yes. So there is good fat and there is bad fat. Yes. So we want to understand how much of the bad fat do you actually have that may predispose you to things like stroke, to things like heart attack. And when we classify and find out how much of that bad fat someone has, then we are able, your healthcare provider is able to intervene accordingly. Ensure that you take those medical routine checks. At least 1 to 2 years, check in with your doctor. The earlier, the more frequent you do it, the better. Now, I look at the age category of those who are 40 years to 49 years. One peculiar thing about this age category is that the metabolism changes. There is a beginning of a slowdown. And so you need to do your regular check-ins, okay? Either every 2 years, okay? Or even more frequently. So what are the things you should be checking for? Non-communicable diseases. Now, non-communicable diseases are a wide range. Just like you hear it, they are not communicable. They just develop in an individual. They are not transferred or spread from one individual to the next. Some of these, like I've already mentioned previously, is hypertension, it is diabetes, different cancers, different cancers that you have to screen for, but mainly for the men, you need to screen for cancer of the prostate. It's good to screen for it even when you have not crossed to over 50, because when the indications, the markers for risk are there, then you can get help early. For the women, cancer of the breast and cancer of the cervix. Now, I have done a video previously on cancer of the breast and cancer of the cervix. I want you to go to my TikTok channel and my YouTube channel and listen to that very helpful information on cancer of the breast, cancer of the prostate, and cancer of the cervix. Then for men and women, commonly you need to screen for what we call colorectal cancer. Colorectal cancer. This is a cancer. All those cancers actually can be prevented if discovered early. They are effective treatments and your life can be helped. Now, I want us to talk about the colleagues that are tending into senior citizenship, 50 years and above. So if you're 50 years and above, what should you be thinking of screening for? All that I have mentioned for the lower age categories, you need to be screening for them. And by the way, you need to screen more regularly, at least every year. Every year you need to check in with your healthcare provider and have the non-communicable diseases screen, the cancers that I have mentioned, cancer of the prostate if you're a man, benign prostatic hyperplasia if you're a woman, cancer of the breast, cancer of the cervix, and of course for both males and females, colorectal cancer. You need to check in more frequently. And then of course mental health assessment for the people that age. Now, I want to talk about other forms of assessment that may not necessarily apply to a particular age category, and these include dental checks. So at least every 6 to 12 months, you need to do your dental checkup so that if you have dental caries, tooth decay, that is dealt with ahead of time. Many of us actually take dental checks lightly. If you have not had a toothache that keeps you awake the whole night, then you will take your dental health lightly. But if you have, then you are going to take these checks seriously. Eye checkups. If you cannot see, you literally can't do anything. You are tied to where you are seated if you cannot see. So make sure you go for an eye checkup. It may not be so often, but at least every 2 years, check in with your healthcare provider and have your eyes assessed. Then we have skin checkups. Skin checkups should happen every time you visit a healthcare provider. This is part of what we call general examination when you visit your healthcare provider. And of course, even if it's not a routine check every time you visit, there may be an indication. You may notice changes in your skin, so you may be prompted to check in with your healthcare provider. Then mental health checks. Mental health assessments should happen every time you visit your healthcare provider. I have done videos on mental health. So I want you again to check my TikTok channel, The Happy Doctor, and my YouTube channel, The Happy Doctor, and listen to that important information on mental health. A lot of people suffer some level of mental health disorder and they are not aware. They are moving around and making irrational decisions, having anger outbursts because their mental health is not in check. Now, as we come to the end of these medical assessments, I want to say that in addition to what I have told you, you need to have sexual reproductive health reviews. Why is this important? A lot of times we leave it to pend, and we leave it, to lie low until it hits us hard. So what are some of the things you need to do? Number one, your HIV status. Your HIV status is very critical for you to know. So if you're not at risk and you perceive you're not at risk, you have one partner, you don't have exposure, yes, you can do an HIV test every once a year. But if you are at risk, for example, you're someone who has multiple partners, your kind of job is classified as risk, as people who have risk. For example, you move from place to place working, yes, as the people who use substances like alcohol, like marijuana, then you have an increased risk. The people who engage in trade, yes, sexual trade, then the risk is increased. You need to do your test every 3 months, every 3 months. And not forgetting pregnant and breastfeeding women. You also have to do your test every 3 months, not just for yourself, but also for the baby that you're carrying and breastfeeding. Then, of course, sexually transmitted infections. You need to check in regularly, yes, especially if you're at risk, to make sure the sexually transmitted infections are diagnosed early and treated. Why? When they are not and you develop complications, they can actually bring you infertility, especially in the women, yes, and some of these are silent. They may not produce a discharge, but they will actually cause you infertility. Then, of course, they may cause blockage, especially in men, of the urinary system. So that's why you see some men will present in the emergency unit and they are unable to pass urine because they had an untreated infection and developed what we call a stricture or a scar, a urethral stricture, a scar in their urethra, and so they are unable to pass urine. Yes. Then the other ones that you should generally check is hepatitis B and hepatitis C. And when you're negative, remember, I've talked to you about immunization. And then, of course, family planning. As a couple, check in with your healthcare provider and ensure that your family planning options are up to date and they are what is working for you. For more of these important health tips, please visit my TikTok channel, The Happy Doctor, and my YouTube channel, The Happy Doctor. And if you feel you need health advice more detailed than this, please drop in the comments, I need your advice, and I'll be sure to reach out.